Hey guys, I'm David DiMuzio.
And I'm Steve Cook.
This is Hair Loss Hope, and we thought this would be the perfect time to make this video because I just had a hair transplant 2 days ago, 2,400 grafts, and so today we're going to talk about 10 things patients ask after having a hair transplant, how to avoid driving yourself insane. I'm actually really excited to get the answer to a few of these questions because I don't know the answer, and so I want Steve to tell me. 1, can I wear a hat? How soon and what kind? I actually have my hat sitting over there, ready to go. Steve, when can I wear it?
Well, you had some temporal peak work done, David, right on the sides, and it looks awesome. As a matter of fact, I can't even tell you how it done, and it's day 2, so that's fantastic. You can wear a hat, but we prefer in the industry a baseball hat that's either clean or new. The hats that you don't want to wear are one of the beanies that either by wool or cotton, because that's not going to work, and that can catch onto the graft. When you pull it off, it can actually pull out the graft at day 2, day 3, day 4. The baseball hats work well, but you have to be very careful around those temporal peaks. So gently put it on, gently take it off, and you'll be fine.
Okay. My baseball hat is dirty and old, so darn, I'm going to have to get a new one.
We'll get you a medical cap that you can wear on the airplane. How's that?
Sounds good. Number 2, Steve, how fragile are my grafts and will they fall out?
So the grafts coagulate pretty quickly on your scalp, especially when done really well. In your case, we did some dense packing, which is insane. And that's all pretty well healed up already, but they're kind of still up for grabs if you whack your head on a car door, which I always seem to do after my procedures, or you hit your head on the corner of a kitchen cabinet. That could be a problem. So a couple things. Number 1 is don't freak out if you see a little oozing or bleeding if you do hit your head. Apply a very direct compression with a gauze pad or even a paper towel, and don't remove it and don't dab it. Just apply direct pressure. Give it about 20 minutes. Sit down and relax, because you get scared or you get nervous, the heart rate goes up and it pumps more oozing through that area. So it's not wiping, it's direct pressure, and then you'll be fine. But question would be, when can I start to not worry about the grafts? I'd say about 4 days.
When can I have sex again?
So that depends on what kind of sex you're going to have.
Okay.
So here's what I tell
Good
patients.
sex.
Here's what I tell patients, okay? Depending upon how active you are in your sexual activities, you might want to put your partner on top.
Okay.
That might be a better way to do it for a couple days. So again, this is more or less geared towards suture lines and FUT procedures, and we don't want any oozing or any bleeding out the suture line, which can create a little bit more scarring. So we want to keep that heart rate down. So if we have to stay and refrain from sex, we're going to have to stay away from it for about 4 to 5 days. Now, if you're going to do it before because you can't help yourself,
real drought here.
A real drought. If you have to do it, then of course you have to be the one that's not really getting that heart rate up, if that will work for you.
Time for you to do all the work, girls. I think I'm bleeding in my suture line. This is with an FUT surgery. Help. What do I do? I'm bleeding in my suture line. Is that okay?
That's okay. Don't freak out. Sit down. What you want to do is keep that heart rate down. The more excited you get and anxiety you get, the more you're going to bleed. Bleeding is normal. It's not really bleeding. It's what we call in the industry is oozing. So the fluids that are pumped into the head for different reasons that we can talk about at another time have to drain out of the body. What's going to happen is most times they're going to drain behind the ears into the lymph nodes, and you're not even going to know that that was used during the procedure. Guess what's back in that area near those lymph nodes? The suture line. If you get your heart rate up, or you get too active and you get your body pumping all the blood, then it can take the path of least resistance, which is out the suture line. That's why you want to keep your activity down. Now, if you get a little oozing on your pillow for a few nights post-operatively, or you even are kind of getting yourself worked up for some reason, you see a little blood dripping behind your neck the day after procedure, again, just like we talked about with the recipient area, you want to get direct pressure on that area. You can actually use ice on that area as well. And you want to keep the heart rate down. So as soon as you start to get some oozing, if you get it, sit down or lay back in the lounger. Get your head pressed against the lounger with a pad or some sort of a paper towel on a pillow kind of thing, and put pressure there. Or if you have someone with you, they can put direct pressure for about 20 minutes, and that'll stop, and that'll just coagulate back up.
I noticed last night, actually, I used a little kind of pillow covering that you guys gave me. And so when I woke up, there were some little dots, on the pillow covering from my sleep that night. So anything to worry about? Or
Again, nothing to worry about. That's mostly fluid that's a little tinted with the red coloring your blood.
Yeah.
And that's just that fluid exiting. Now, in your case, David, since you had FUE, you've got all these little punch marks. And that fluid's going behind and into those lymph nodes. And some of it is kind of oozing out of those sites.
Yeah, because I noticed you're right, it wasn't really too much blood. It was more of like a yellowy kind of,
Right.
thing.
That's part of the process. So again, this video is set up so that you guys can learn how not to freak out if you see these things happening post-operatively.
Number 4, I've had a lot of guys ask me, and even I was looking in the mirror last night and wondering a little bit about, and that is my brand new hairline. It looks uneven. What the heck?
Great. This is my favorite topic, David, post-operatively. So think about this process after all the research that you have done, that we have done, and choosing the right doctor, right clinic. In the morning of the procedure, and there's a few videos that we'll talk about as well that we're going to come out with that go over the pre-operative consultation with the doctor. You're choosing a doctor that has put together a clinic which it requires 50% science, 50% art. This part of the procedure is 100% art. The hairline design is something that you chose this doctor for. No one's face, no human being's face on this planet is perfectly symmetrical. That would look ridiculous. Anyone that draws a straight hairline on either a male or female will look completely unnatural. What are you paying for? You're paying for all the hairs to grow. You're paying for it to get it as dense packed as possible, and most importantly is naturalness. So when the doctor measures, and there's a certain measurement they use, when they use centimeters in the industry, and they're measuring different parts of the face, we are all asymmetrical. Your hairline was painted or marked on you asymmetrically prior to the procedure, and the top doctors will confirm that with you and have you look at it in the mirror, because sometimes they use a little more aggressive hairline, that's your choice, or a little more conservative hairline, that's a choice. But once it's agreed upon between you and your doctor and whoever else you have in the room, a friend, your wife, your partner, then once that's done, it's done. So when you go home and you've had all this medicine in you and you wake up and you start looking at the hairline, oh my God, that's not what we agreed upon. I mean, not for nothing, but that makes no sense, okay? It is what you agreed upon. It is asymmetrical, and there's a lot of swelling. There's a lot of fluid up there. So relax. You can call the clinic, your doctor, and they will explain this to you. But there has been many cases that I've seen through the years where, patients are extremely obsessed with their hairline. Myself included, David included. And it's all something that we all do. But if you get too crazy with it, you're going to drive yourself insane. Mm-hmm. So you've already done the homework. He's an amazing hairline doctor. So yes, if you have questions about it, of course, call your clinic. But this is a normal part of the post-operative kind of anxiety. I think the hairline's a little different, and that's supposed to be the way it is.
There's also something that I've read about cosmetic surgery that has been studied, that people actually don't get used to new things on their face for about 30 days. I think it takes around 21 to 31 days before you will actually start to enjoy something new. Do you know what this statistic that I'm talking about?
I haven't heard the statistic, but I know what you're talking about. And yeah, think about what we're doing here. Look at this. This is why it's a great time, is David had his procedure 2 days ago. And that is not a straight hairline. That is a male hairline. Dr. McGrath did a great job with your temporal peaks, and that's one of the things he does phenomenally. Mm. But if David didn't know what he knows, and he didn't have a YouTube channel with hair loss, and he was doing other things, and then he goes back into the hotel.
I would be totally freaked out. Absolutely. Yeah. To be honest, I already liked my hairline, and my hairline was already quite uneven. I remember the first time that I Dr. McGrath did my surgery, 6 years ago, and it was kind of uneven. I remember that time going, ooh, it's a little bit uneven, and then it grew in, and I was like, wow, I really love it. And so I've loved it ever since. I've really loved my hairline. And then Dr. McGrath actually changed it just a little bit. I don't know if you can see right here, it kind of, there's a new little spot where it kind of almost does 2 different widow's peaks type thing. And so the only reason I didn't completely freak out about that is that I really trust Dr. McGrath at this point. And so I was like, okay, I know that he meant to do this, so I'm going to give this time. I'm going to let this grow out. I think there's a really good chance that I'll like it even better. So I totally trust him when it comes to that, and I've seen his hairline design. So, but I mean, honestly, if it wasn't for the fact that I have so much experience with him, I would have seen this and just gone like, oh my gosh, like what the heck just happened to me? So I can totally understand you guys' pain. There's a guy who's written me like every day for the last 4 or 5 months on Instagram, and Dr. McGrath did his hairline. And I remember when he first got it done, he wrote me and he's like, hey David, what the heck, my hairline is uneven, this is so weird, like did they mess this up? And he just wrote me a couple of days ago on Instagram and he's like, oh dude, I love my hairline, look how good this looks.
Yeah.
So yeah, don't freak out too much about that. If you've gotten a good surgeon, it's really going to turn out awesome.
And one more thing I'll say about it, David, is, if you go overseas in some of these places that charge like nothing for a hair transplant, I've been checking this out, I've been watching this pretty closely for all the reasons we know. And, there's a lot of really flat hairlines, okay? They're not male hairlines. They have no artistry to them. I don't name any names or name any clinics, but when you've got a hairline that is perfectly equal with no asymmetrical to it, watch out. That's when you got a problem.
Yeah, then that's definitely the ones that I've seen that look the most unnatural are those like perfect little semicircle type hairlines. They look really freaky, actually.
Yeah.
Number 5, Steve. The doctor did not put grafts in my crown. Why didn't he do my crown?
Okay, so this again goes back to the pre-operative consultation. You need to make sure before you choose your doctor, before you choose your clinic, especially if you're someone who's doing 2 separate zones, and I'm talking about large zones. For instance, we're doing 3,500 or 4,000 grafts in the front and in the crown. You need to be very clear and have documentation in your preoperative consultation on where exactly those targets are going to go. One of the pet peeves I have is clinics that are very wishy-washy. They're not specific. They don't have any documentation. Anybody can say anything, but photography needs to be taken. They need to take photos, obviously, before the procedure. They need to take photos after the grafts are placed. And anything that they tell you they're going to do needs to be in writing. Now, let me give you an example of how this can go wrong. What you don't want to do in a hair transplant is spread out the grafts. That's not going to work. David had 2,400 grafts done. A lot of it was in the frontal third, and then we had about 800 left to get into the crown. So if you look at David's head, if you put your head down a little bit, David, in this frontal zone right in front, that's a good 1,600 grafts. That's a lot of grafts in a small area. So imagine if you're bald and some doctor tells you, yeah, no problem, I'm going to do the front, the mid-scap, and the crown. And nothing's in writing, nothing's been documented. It's a problem, because if the doctor does do good work, he's not going to be able to get all the way back into the crown. What he needs to tell you is, here's what we're going to do. After we design the hairline, and we agree upon that, depending upon how that aggressive that gets, we're going to dense pack these things from front to back. We may get 0 in the crown. We may get into the crown a little bit, just so you have some coverage, or we might, if we get enough grafts, we might actually be able to hit it pretty hard. But what you don't want to do is go home the next day, grab that mirror, look in there, thinking that you've got full coverage and you've got dense packing in the crown and nothing's been done. That's not a comfortable situation. So it's all about communication. The top doctors, the better doctors that Dave and I represent out in the country will all have this all agreed upon prior. And if they don't know if they can get into the crown, it's going to be communicated that way. So there'll be no surprises. This is not a good surprise to have if you're on the wrong end of it.
Yeah, this is something that Dr. McGrath and I talked about prior to my surgery, was I really wanted to focus on the front of my hair and really getting that much thicker and just having that look good, because the crown doesn't bother me as much, even though I actually have the most space there. It's also the easiest to cover up, and it's the thing that people sort of look at the least, and especially the way that my hair was. I don't know if you can kind of see, but it's not as easy to see probably with.
Just tip your head back a little bit.
Okay.
So
I wanted to show, so the way that my hair sort of worked, if you looked straight on from me prior to this, it didn't look like I was losing hair in my crown, really. So because it sort of went to about right there. So because of that, it's sort of like, you know what I mean? It's sort of like, it wasn't like far down on the crown. It was sort of like only a bird's eye view to where it looked very empty. So if I put my head down just like this, and showed you my head, then it looked quite empty because it's like right there. But that's not something that people viewed really. You know what I mean? Nobody looks at you from over the top of your head unless they're really tall. And I've never slept with a girl who was like 6'5", so it's never been an issue with. Well, maybe that's why I never have. Yeah, because they're looking at me from a bird's eye view. But anyway, so. Yeah, that's just never been a super important kind of thing to me. And again, very easy to cover with concealer if I ever wanted to. But we got to the point where he felt like he'd filled in all of the front, and so there was that extra, and so he ended up going into the crown.
Great example.
All right, guys, watch out for part number 2, where we're going to go through number 6 through 10 of other key things that you'll want to know. That are questions that I definitely want to know the answer to, so we don't freak out after having a hair transplant.